which we're doing twice a week. No, we're doing it once a week. I have so many meetings. So welcome. Thank you for your time. It's an opportunity for the team to talk about the work they're doing and also to share ideas and talk about any resources they may need or assistance. So let's get right into a brief out. Let's start with RSF1, Steve or Diane.
I can jump in if you'd like to, Steve. So our
go ahead and lead out.
Good morning. So our RSF has been busy over the last couple of weeks, like a number of you. We did 2 webinars last week that were really well attended. One of them had over 100 participants trying to get the word out to the business community and any business or organization that might not fall into one of the other RSF categories. So we have set up a portal of information and how to apply. So if any of you all receive inquiries, you could direct them to lawrencechamber.com/cares, which is our main link. And we will have the deadline on this Thursday at noon for those proposals, and I'll be working really swiftly with our group to get those turned back around to the county for their process deadline on the 3rd. I did want to mention that we have been fielding a lot of inquiries from businesses and others regarding these proposals, and some of them we're seeing may have better been addressed in other RSFs than our RSF. We have an example of a business that really has been closed, and what they've been doing is more in the human service category. But unfortunately, by the time they worked with us, we understand that the human services and housing group had already closed their application. One of the other examples that we have received is a request for PPE reimbursement from a nursing home. So that was one that we would have thought would have come under the RSF dealing with health and those aspects. So that would be something that I would just note. We're getting a lot of those. We're doing our best to get back with them, and we'll try and forward notes like that to the county if groups like that come through to us. And I would turn it over to Steve, or I think I saw if Jasmine is on. Yes, Jasmine's on, and others from our group to add additional comments.
Yeah, kind of just to follow on to Diane's comments. You know, we had a meeting yesterday at 4, and I think we've had 10 applications as of that point. And as Diane said, they're very varied in terms of what the content is, the activity that they're involved with, etc. We don't know how many to anticipate. As she indicated, our portal closes, or our application period closes Thursday at noon. So we'll see what we get. We know that there are a number of others, as I've talked to, as I know how Diane has, a number of folks in the last few days that are intending to apply. So my guess would be that tomorrow and into Thursday, we'll see a real flush of them. And again, one of the things that we're dealing with is, as Diane said, we're getting applications that are, I think they're certainly appropriate, but we kind of wonder when we go through them whether they're really would be our best suited for our particular RSF. But I think one, because maybe they weren't aware as much of some of the other RSFs. And then the other thing I think that's probably playing into it is I think probably the last open game in town that all the others have closed. I think, folks are looking for a possible option, and we're the option that still is open. So we're seeing applications that are very different one to the other. So it's going to be an interesting process to go through them.
And I guess if I could chime in here, I appreciate that we've asked RSFs to do some things that aren't always fitting. And honestly, don't sweat it. just get it to us. I mean, so, I mean, at a certain point, if, you know, we'll make it work. In terms of if it doesn't fit out in your ranking, like, don't worry about it, just get it to us. And we'll try to do our best to, but like, that's why my next comment, like, I need this information as soon as possible. So we have a lot of work to do once it comes to the county. So if there's any way we can get it like over the weekend or as soon as you're done with it, Diane and Steve, in terms of your rankings, like I mean, I'll take it as just absolutely as soon as I can get it. And just, if you have it, include it, and we'll figure it out on our end to try to get it incorporated into the right place.
We
We'll try our
appreciate
very
that.
best to turn it around.
Yeah, and then we'll try to flag those that seem to be odd fits or maybe better suited in other RSFs, and we'll note those or flag them in some way so you're aware of them.
Perfect, thank you. Anybody have questions or conversations around economic recovery for Steve or Diane? So I would just ask you, so you say you had 10 as of yesterday. Have you heard from other businesses that you expect to see more from them, or others coming in?
I would anticipate that we would get more applications. I think it's difficult for us to predict how many applications we may get. And that may very well impact our quickness and how to get them to the county. If we don't get much more than the 10 that we have, then that'll be fairly straightforward. But I think, you know, we really don't know what to anticipate. We might receive a lot of them. I think it's interesting, we received 10 already and the deadline is Thursday. I would anticipate our numbers will ramp up significantly as it looks to the deadline, just because of the, you know, we gave the businesses and those interested in applying through our group just a little over a week to turn these applications around. So that isn't very much time.
Robert,
Great.
the other thing, Robert, is I think that we're anticipating that we'll have some groupings where there'll be multiple businesses or multiple organizations that will combine and come in, and we haven't seen those yet. So I think that there will be some of those where there will be multiple businesses or organizations represented, and those I am anticipating will be much larger in terms of dollar requests as well.
Of those
Perfect.
10 applications, do you want to disclose what the dollar amount total is?
I don't know that we have actually totaled it.
Okay.
We did a quick
Don't know yet.
run through last evening.
Okay.
Hey, Robert, I have a quick question.
Mhm.
And I imagine, and this kind of goes for all of the RSFs, this is Jillian. If we as RSFs or those that are running these, if we see a need that isn't particularly addressed in one of the applications, so if there's, you know, let's say one business that asks for reimbursement for maybe some of the changes that they made to their business or PPE supplies, is there a plan to submit some broad-based projects for things that we know are needs but may not specifically come in as a project just because people weren't either aware of the process or just didn't put in their application? That may not make sense, but I'm hoping it makes some sense.
Jillian, I guess I'd like to say it a little bit. I mean, we have to submit a direct aid plan, like, and it has to be detailed as to how we're going to spend it. So I don't know that I can just sort of hold open like how we might spend this in the future. Just the timelines and deadlines are so tight. And I would say too, this isn't the only round of funding. And that's what I would like to talk about later in the meeting. Like, you know, there's going to be some more money coming down the pike here. So I think it's important that not everyone sort of think that this is the only thing that we will get reimbursed for, and that we try to, that we just try to keep our minds, you know, focused on that there are additional funds coming down the pike.
Yeah.
That makes
Okay.
sense. Thank you.
All right, thank you. Let's move on to RSF2, Health and Medical Services. I see Tracy's on. I'm not sure if Beth is on.
I can speak, and if Beth comes on later, she can add to it. We had a special meeting last week that we discussed. There's Beth. The 3 applications that we had currently, and they were from LMH, Fire and Medical, and Burt Nash. And then we have, and I think the health department had, we did not get time to review theirs at that time, but we will this week. And then we have since then received like 3 more. So we've only had a total of 6. Is that right, Beth?
Actually, I think there's, we've had 3 transfers from RSF2. I've had several that have reached out to me that came in yesterday. It's a lot of program tabs. I do know that.
Yeah.
So, and I'm so sorry, I was in the middle of something else and let this time get by me. I know for us, and Diane, I was trying to respond to your question this morning. We've had inquiries from people that listened in on economic recovery. Is this where we belong? We've had inquiries from other organizations. But yeah, anything I didn't have yesterday was clearly communicated last week, and any inquiries I've had were responded to with our instructions and the templates that were created. So
We do have 2 meetings scheduled this week, Wednesday and Thursday, to make sure that we're able to review all of them and to be able to prioritize all of those needs together. So there's a lot of money on the medical side, probably, but that's not surprising because of the need being there. So
Beth and Tracy, so can the county anticipate that we will receive your rankings late Thursday?
our deadlines have all been the 31st, Sarah. Do you need us to?
What time on the 31st? I mean, honestly, can we get it at 8 a.m. or when can we expect it?
If you need it at 8 a.m., we'll do that. And we will, what we're going to need to, I'm sorry, my computer's being unstable here on me. We'll crank that up. It's going to just require that the coordinators, Tracy and I, finalize anything in question. We have asked people to submit with their high, low, medium, so that our 2 meetings this week are an affirmation or questioning of what people have requested. And we will have, we're using a process similar to RSF3, where they worked through with organizations this week, that validation process on a single Excel spreadsheet. What we did last week, we will not be able to repeat and get through the work. So we'll have it for you, Sarah. I'm not sure what it'll take, but we'll go with what we've received, and we've got 2 one-hour meetings, Tracy.
yeah.
I appreciate that, and I know that this is an imperfect process, but the sooner we could, if we could have Friday, I mean, since your request is the biggest and the largest,
Yep.
like if I can have it first and build things around it, it makes life easier.
Well, that makes perfect sense. We'll find a way to make sure that happens. The one thing that was brought to my attention this morning, and we've got people that are apparently sending in requests through a generic portal, and I missed that. So I'm not sure. And I had one of our folks said, well, I'm also going to send this through the portal. And that might be an RSF3 project management design, but I honestly didn't know what that meant.
Are those coming out of RSF1, your portal? talking about here?
Our RSF does have a portal, RSF1. So we have a lot of information on the website about how people would apply. We did a lot of outreach, and we have an application online that's kind of streamlined with the questions that will guide our ranking that the county has asked for. So it could be that they've come to ours. We did try to publicize it a lot.
Okay. So it's probably some of those after the fact people that you were talking about earlier. They're just looking a way to submit an application that started with you guys and they're trying to get it over to RSF2, possibly. Are you getting this through email, Beth?
The ones that I've received have come through email, which was our instruction, Robert. But as people have, other organizations have seen themselves in the broad COVID ask, they've found different ways. So I guess the summary on today, Tuesday, is that if my colleagues in the other area, Diane, if you see something and your best judgment is this is PPE for a direct COVID healthcare provider, including any level of care, send it my way and we'll do what we can to rank it and review it if you had it yesterday.
Well, let me, I don't know exactly when the deadline was that when we received it. I would have to look back. I guess I'm going to ask Sarah. I anticipate that we will be receiving more of these that don't fit neatly into our RSF. So based on Sarah's comments that I think she made right before you joined, Beth, our intention will be just to send them with some notes to the county that perhaps they should have been considered under another RSF, but we felt that we will definitely forward every single application that comes through our group.
Yeah, I think that's fine. Like if it came in today, it sounds like, or tomorrow it could go to Beth and Tracy, but like, if not, just when in doubt, just send it to us and we'll figure it out. So, and I think that goes for every RSF, when in doubt, if something weird comes in this week and you don't get to it in your regular process, just tag it on to your email to us.
That's helpful. Thank you, Sarah.
Any other conversation around RSF2 health and medical or questions? Let's move on to RSF3, Housing and Human Services. Jill, are you on? If you're talking, Jill, we can't hear you.
Sounds like she may be having some audio problems.
Yeah, Jill, we can't hear you. We'll circle back to you if you find a better place to get a connection, and we'll move on to RSF for Julie or Andrew, or both.
Yeah, hi. Let me turn the camera on. Can you hear me?
Yes.
Cool. So we received about 7 different organizations submitted applications. I have not totaled those up. I'm working on them now. I had to go get another computer because my Excel, it doesn't work anymore on my desktop. And I don't see a whole lot of issues with it so far. The one thing that's somewhat confusing, and I think Sarah, you had sent me a message, is I only have one USD that's submitted in my group, and I need to go back out to them tonight and ask them where the other USDs are at. Did anyone else get submissions from USDs?
No, and we've checked, we don't have any. So if they would like their money.
Sarah, I think there was some mixed messages. I believe some, at least Lawrence, is under the impression school districts could submit direct to the county and that private entities were submitting to the RSF.
So that is
It was said at one of the meetings, so
it was related to reimbursements. So that's what we said at the meeting, is that reimbursements that have been incurred from March to current can be submitted directly to the county. But anything you want from today to the end of the year needs to go to the RSF. And I thought we kind of talked about the difference between reimbursement and direct aid.
But either way, you don't have any of those submissions. So even if they submitted it under the wrong spot, we'd still be able to account for them.
I think that I'm not involved. Our finance director is involved with that, but I think that they were working on a different deadline than the RSF deadline, Andrew. So if information needs to be given to the finance directors, different information, we can see that that happens.
Yeah.
I don't know, did they meet with Brooke? I thought they met with Brooke. Did
They
they?
did, and that's mostly about reimbursements, not direct aid.
Okay.
Brooke is, and so if that, Andrew, if you could make that clear to your RSF that like, honestly, we need reimbursements too.
Yeah,
So,
and in the RSF, we're having we have the superintendents largely. So if Brooke or Julie, if you all want to contact the finance directors and have them submit either directly to me or to we're putting everything into the Google Drive that we have, and then we're compiling it up there. It would be preferable that they do that.
Yeah, and Julie, I just want to, is it Kathy Johnson? Okay, thank you.
So one of you will be able to reach out to them, to the finance directors for all the USDs. And we have
well, we can reach out to who we have. So I guess Brooke can do that, but Andrew, I think it also just belt and suspenders right now. If you could also send them an email in terms of their direct aid plan for anything from the today, future, that needs to come to you all.
Okay, Julie or myself, we can send out something to the superintendents letting them know.
I can do that, Andrew.
Okay, thank you, Julie. Other than that, it seems like things are going pretty decent within our group. I'm compiling everything up, and we'll make a summary page with all the individual projects that are being submitted through our RSF. And then on Wednesday, the RSF, tomorrow's Wednesday, right? We'll meet and we'll look through those just to make sure that everybody's got what they want in there and it has the right numbers that they intended to have in there, so that we can submit that up for Friday to y'all's. Julie, do you have anything else to add to that? Did anyone have any questions or comments for RSF4? Ours is as clean as it can be with the short timeline. I think we haven't had a whole lot of trouble with it.
Have you heard anything from the other colleges or Peasley?
I have not.
Robert, this is Steve. We do have a request in ours from Peasley for a training program, to support a training program. So we do have a request from Peasley that's in the hopper now.
Perfect. Thank you, Steve.
And we're welcome to put that within ours if that fits better. Whatever you find most comfortable for that, just connect us up if you need that to happen.
I think our initial thoughts was, since it was set up for training for folks who had been displaced, lost their jobs, that it was probably a good fit in ours. So
yeah,
that's how we're handling it to this point.
No, I think that makes good sense. Did anyone else have anything that overlapped that they saw in educational institutions that they felt like maybe needed to be addressed by RSF4?
Any other questions or conversation around education for Julie or Andrew?
I don't have specific questions for them, Robert, but I do have some kind of overarching questions or comments for RSFs as we continue.
Can we, okay, I'll come back. Can I come back to you, Sarah? And I think Jill's ready to report out. Okay, perfect. Jill, let's go to RSF3, Housing and Human Services.
Yeah, I'm sorry. Let's see, RSF3, our deadline to receive submissions was last Friday at 8 a.m. We received 60 program requests. I'd say from a total of maybe 25 to 30 organizations, but 59 program tab requests. We did an initial review of myself, Shannon Oury, and Leah Roslin and Kara Smith, our 2 equity impact advisors. We did a marathon review session on Friday afternoon, and we were able to utilize the responses for the equity impact assessment tool, combined with the 5 focus areas that our RSF developed a few weeks ago, and we've shared with this group a few times. So that really made it pretty easy, relatively speaking, to evaluate the requests. All of the requests were very compelling. Majority were compelling, especially when you can frame them up in the focus areas that we developed in advance, and we had really good, strong shared agreement on in terms of their relevance to our work. That being said, there were a couple of them that did not have any applicability to those 5 focus areas, excuse me, but we reviewed them anyway, to the previous conversation that came up. And we ranked them, and we're going to get them in because that's just where we're at right now, as I think Sarah has articulated. We did refer, and I think Beth referenced it, we referred 3 organizational requests to RSF2 that I know Beth has, and we talked through yesterday, and those were for approximately, I would say, well, total requests that came in before we referred those RSF2s was $4.5 million. Once you take out what we referred to RSF2, our total is $2.8 million in requests. So we've got high, mediums, and lows. We have a lot of highs, and for that reason, we did a priority ranking within the high category. So each of our team members, our initial team members, did a ranking of the highs over the weekend. And then, so we had a good list of priority ranking within the high category. And then our RSF, our full RSF, met yesterday at 9:30 to review our recommendation that was the full ranking, all the highs in order, and then the mediums and the lows. And we had a few questions, but overall we got support and agreement and a blessing to move forward in working right now to put together my master tab sheet for Brooke. Keep moving forward.
And just to jump in there, Andrew asked if there was anything for RSF4, and that one from the United Way we decided was for RSF4 with the school supply request.
There is, and I think for now I'm just going to keep it. Yeah, I think it might be more streamlined. I mean, Andrew, I'm happy to send it to you, but the sense I got was that we might just be you want one on the big priority stuff. But yeah, the biggest chunk of referrals that were, I think, really appropriate to be referred to RSF2 were things for testing and PPE and modifications, things like that, that really needed to have a health and medical assessment, in our opinion. But we did give them a high, medium, or low ranking based on what we knew about them. But at the end of the day, we thought it was much more appropriate for them to be included and reviewed by RSF2 because, as again, Sarah, I think, alluded before, we really need to have an understanding of what RSF2's recommendations are first, or at the outset of this work.
Thank you, Jill. Any other conversation or questions for RSF3, Housing and Human Services? Sarah, do you have some comments?
Yeah, and this tags on pretty well to what Jill said in terms of how they created 3 focus areas and how they set their priorities. I know RSF1 has done some of that, and I wanted to verify, Diane and Steve, I think it's on your website, right? Kind of the high priority areas for impact funds.
Yes, this is Diane. So at the lawrencechamber.com/cares is where we have that information, and we wanted to be very transparent with the 4 elements that would really drive our categorization of the low, medium, high priority, and all of that information is on there.
Thank you. And I would say to 2 and 4, as you kind of do this work, and it doesn't have to be super fancy, but but whatever sort of helped frame your decision making in terms of that high, medium, and low, I would appreciate having that. I think the county commission would appreciate having that. And so if there's any way when you send it, if you could pass that along or some thoughts on that, or we can schedule a quick phone call, I'd really appreciate it. One of the things I wanted to talk to through this group is, so we will receive some of this stuff as like on Monday, possibly Monday the 3rd. Our intent was to have this group see the whole thing. We don't have a meeting scheduled right now for the 4th. If that is something we want to do, I guess I want this group to be thinking through how you want to review this information, because I'm honestly, I'm not sure I'm going to be able to get it to you in advance. And I apologize for that, but you all understand the timelines we're under here. So I guess I wanted, I guess I just wanted to make sure that folks had a chance to think about how the coordination team would review this information.
Sarah, are you suggesting we do that meeting on Tuesday or not? Is that what you're thinking?
I'm suggesting we do it, but I'm also suggesting that this team will have no time to have reviewed information in advance. And so if that's a concern, I need to know, and then I have to push back a county commission conversation. So I need to know now or soon if folks are comfortable with just us trying to walk through it over a Zoom call and an email.
Sarah, this is Russ. I think that's a really good observation and reality that we're facing, and how do we do that effectively? I really like your suggestion about are there filters through which we can consistently consider each of the requests, and are some of the RSFs already developing their own set of criteria or ways in which they are determining priority, and maybe we can adopt those. If we're all using something consistent like that when we ultimately define the priorities and make recommendations to the county, we will have a much more efficient conversation.
And so, yeah, that's why, like, I mean, I can take what I have from 1 and 3 and begin to prepare that. I was going to do that work anyway, but I don't know with 2 and 4 if you've really, and I didn't ask you to like have established criteria. So I think I can get that to you on the 4th. Craig asked if we could get a listing of projects. I'll try, Craig, but if I don't get it till Friday, if I don't get it till Monday morning, we're going to be scrambling. So to try to, because I have other commitments that day as well, and the team does too. So we're going to, that's our best, to do our best to try to get it to you. But you likely won't get it till end of business Monday. So I would just ask that folks understand that, we got 60 requests from RSF 3. I anticipate, each RSF may have at least 60 total requests. So
Sarah, RSF 2, just to share in what Russ is, we will have, because it's part of our internal process for readiness, but we will have a single Excel spreadsheet that summarizes and has the prioritization on it for you when all of the individual organization requests come to you. And I will make sure that in the way that is presented, we had prospectively a high, medium, and low definition that was tailored to health and medical as a priority division within this round. So we'll have that as part of our package to you that you have Friday. So I think it's going to look different than RSF 3 simply because of the priority of this round. But we'll have a system that will enable you to do what you need to do.
Thank you.
No.
So I guess I would also say, I think I can try to get you that order and we can try to send stuff out. I don't know how long it will take to review this. And so I don't know what everyone's calendar looks like for the 4th. I'm doing nothing but this. So I think it really just depends on everybody's, I don't know how long you want to schedule. If I'm going to tell you, I don't believe an hour is sufficient to even walk through all of this.
Sarah, what if we extended the meeting 10 to 12 on Tuesday as a start?
I'm supportive of that if the group, and I totally understand that we may not have everybody the whole time.
May I ask a question? This is Diane. What will be the role of this group with regard to the submittals that day? And I mean, is this team making a recommendation to the county commission? And if it was already answered, I apologize. And then what are the expectations of each of the RSFs for presenting? How do you want the information presented? And maybe if we know how we want it presented, we can adjust accordingly.
So my hope for the 4th would be that sometime between Friday and Monday, county staff has taken all of the 100 million in requests that everyone's going to submit, and we would give this team on the 4th, hey, here's our quick down and I'll just say it, down and dirty on the 25 million that we would as staff think make the top of the list. And then this group would see all of them, theoretically, and we could talk through that. My goal is to have you review it. I don't to feel like we have knocked out major hurdles. I don't know if I'd love to have a recommendation from this group if this group feels it is supportive of that. But I understand that might be a bridge too high to make. But I at least want this group to see it, review it, test our assumptions as staff from what your work was in terms of building that 25 million. Does that make sense, Diane?
Yes, I think it's helpful. I mean, just for myself, I think it would be difficult to weigh in on the work of other RSFs and just under the time constraints that we're having.
And I totally understand that, but I guess that's why we thought a broad-based group of community leaders thinking together collectively and at a strategic level about the community, knowing that this is difficult decisions, that there's not enough money to go around, that they've at least looked at it and they don't, that if you have heartburn or somebody has a major issue or crisis, like I would like to know about that from this group at that time, as opposed to when it goes to the county commission. Does that help a little bit? And I would ask that, like, I think RSFs could, I'm not anticipating like you guys we can talk about that offline. You guys probably are the best people to walk through what you've put forward, but we'll have to, and keep it kind of moving from that perspective. And so I'm not envisioning massive presentations, but you will have read them probably even in more detail, and county staff will have read them, but you're not going to have read RSF2. So if that makes sense. And Casey put in the chat, like, can the group focus on the high priority of each RSF? Yes, but I'm going to tell you, they're going to be 50 million in highs. So I don't know that that's going to get us off the, and I think, I don't know that that's going to get us off the hook. Maybe I'm wrong. I'll eat a giant bag of crow if this comes in at 25 million.
Sarah, just a question here. I think when I'm doing mine, so what I'm doing for our group to do a review is I'm making an Excel document that has information in about the project name, the title, the organization submitting it, the dollar amount, the RSF ranking, and then I'm building somewhat of a crosswalk tool inside of that Excel sheet so that we can crosswalk. We can list all of the projects from all of the organizations on one Excel and then have a crosswalk right there next to it so that we can immediately look at it. Would that be helpful if I shared that with the group, and then maybe we could all use a very similar model so that we can put every single one of them into this like summary crosswalk document, and then as a group it might help to do that? Or is that asking too much?
My assumption is most groups are going to get you something like that. I know that Jill's group has something like that, so you can certainly share it.
And Jill, if your group already has a summary document like that, if you wanted to share it out, that might be something, and we can.
Andrew, I think that's a great idea, just in terms of when you have limited time, just the formatting of the results helps, you know, so you're looking at everything the same way with the same information in the same place.
So whoever's the furthest along on that process, we could use your document. I just think
thumbs up, Andrew.
Okay, cool. It'd be easy that way. We just are all using the same set of standards for how we're reviewing, summarizing, crosswalking, and verifying, so that when it comes time for presentation to both this group and to the commission, there's an orderly process for it.
This is Craig. Is that the intent? So as you're saying 100 million, and that's a good number to kind of stick in our minds to the challenge. Are each of the groups going to give us some cut? Is that?
I've not told them, I mean, because I don't know who's got the most. So, and honestly, I don't even have a total on reimbursement yet from public entities. So I don't even know what to tell you to take off the top in terms of reimbursement. So yeah. We have not given any dollar amounts to any RSFs because I don't even know how much I'm going to get, how much is going to be left on the table, and reimbursements aren't scheduled to come in until Friday, folks. So, you know, the timeline is we, in hindsight, and I will own this, we should have backed you all up and had all of this due Monday. And so that we would have had time as a county to prepare it. And so that's on me for not having put enough time in this process to do this work right.
So my suggestion is somebody that might have to, you know, we're talking about only funding 25% potentially of what the requests are or less. I think each of the groups should give some kind of cut or priority, draw a line somewhere on their list to, it doesn't mean that the stuff below the line isn't, maybe somebody's going to pluck one up and bring it up if we hear something or we really have a good reason to pull it up. But as a starting point, it'd be nice to have the list cut in half at least from the evaluators at each of the RSF levels.
Greg, I think that's what we're going to ask our RSF to do, is to tell us which one is the absolute number one that we want to recommend, which one is the absolute number two that we want to recommend, so that when we get to the actual review process, we can say, we know there's a limited amount of funds. If we can only fund one thing out of RSF 4, this is what we want to fund.
Yeah, ranking is even better.
Yeah,
and that's that's where I would just say, like, I'll share with everybody. I'll give it to Jillian to share out, but that's why we sub rank the highs, and you can see the numerical value that we gave to each one. So a 20, there's like 5 20s that got up like the highest possible score ever. So that'd be our top 5 right there. So it's real easy to give you that recommendation, and I'm happy to share that with others.
I think we'll be able to muddle through it, especially with that kind of a ranking system. It's not going to be perfect, and everybody's in agreement on that, but I think we can manage cutting through that.
I like it too, Craig, because it broadens the input and feedback of the group and kind of broadens accountability a little bit.
So I saw on the chat that Diane talked about the high, medium, low. So Jill, did you guys just rank your highs in that 20-point system? Is that what you're talking about?
We just ranked the highs. I asked them to give it a 1 to 5, 1 being the lowest, 5 being the highest. And amongst the four of us, you could get a perfect score of 20.
Gotcha.
So yeah, and I think that's important to remember that ranking, like for Diane, that just came from the RSF coordinators and the equity advisors, not the whole team.
Right, and we walked the group through that just for full transparency. They saw the full list of requests. They saw how everything ranked out. So we didn't show them our individual rankings, but we showed them the cumulative score for all of them.
I'd like to maybe suggest then we really know who is, if you will, voting on this group. There should be wide participation, but the decision should be, modeled. We should understand who it is that's doing that going in. Sorry to be indelicate, but I think that's going to be. I mean, we're just dealing with some logistics here, so. I'd also throw out that we had a great success with having a lot of people chatting on our strategic planning thing the city did this last weekend. And a lot of people were chatting and throwing in comments that were helpful we could all read, but we had only a small number, meaning the elected officials, participating in conversation. And I thought that was a nice blend. So I'd throw that as a suggestion for our meeting on Tuesday.
That's helpful, Craig. I think with that kind of information, I think county staff can go back and kind of structure that review for the 4th. And so you guys kind of know what we're coming into with that. That's helpful. I would also say that and I could be wrong. It may not be quite, I do think it'll come together. I just want to make sure we have sufficient time. So the 2 hours I think would be helpful if folks can make that work for the 4th. And then hopefully we can kind of pull all those pieces together. There was something in there I wanted to mention and now I forgot about it. I'm sure it will come up as I think about it. One thing I did want to talk about, if we're kind of, that I know will be a consideration of the county commission when we do this. And Jillian, do I have the ability to share my screen? I think I do. I'm going to show you this document. Can you guys see it? It's like a Word doc.
Yes.
Okay, so this is what Brooke has put together. She is listening to all the SPART committee conversations and all of those webinars, bless her heart. And what we have come together for, what we've seen, and this is weird on my new computer, so I apologize. Anyway, so it's a, so there you go. So round 2 really was radically changed from what we originally thought as it having a focus solely on economic development. And there has been a lot of areas opened up here for our state and our community as a whole. And I really feel like it is a recovery function for this information to get out to various RSFs in terms of other funds that are coming down the pike and that folks should be applying for. I do think the commissioners will say, hey, nursing homes are going to get $20 a day for 120 days per bed. So maybe our priority doesn't need to be as much on nursing homes, and maybe there's over almost 10 million in early childhood investments. So I know that's something that RSF4 is going to have some of that information on. There's 55.5 million for higher ed. So I do think that this would be something that the commissioners are going to somewhat take into consideration, that this is just one piece, one spoke in the wheel of the funds coming down the pike. So I say that to help inform our work here on the 4th as we make recommendations. But also, I think to me, it's a challenge for this team that how do we as a community really get the most of the, maximize the investment of these funds into our community. And how are we, the city, the county, the chamber, going to make sure that we are bringing people in our community together to apply for these funds? And that, to me, as soon as we get the direct aid plan settled, that is our work here in this team, is how do we bring things together for this? I am totally willing to have the county help with this, but like as we've talked about, like I really don't have the infrastructure to apply on behalf of massive agencies in our community on this. And each one of these has a separate timeline and deadline from their state agency. So I guess I would ask you to at least share this information, and we can make sure you have it with your RSFs as you finish up your work on the round 1 CARES Act funding. And then I'd love for us to talk about how we target some of these projects and bring more investment to our community.
Thank you, Sarah. I see Diane's question related to that is can we get this information put out instead of, I don't know if you see it in the chat. We can definitely put that out, Diane, to the list that we have, if that's helpful.
And I would say that we can also send you the 100-page PowerPoint from the Spark Committee. It really is pretty easy to maneuver. So it's, they have a table of contents. You go down to page 60 to learn more about connectivity. And you can kind of see what they put together. So while it's imposing that it's 100 pages, not everybody's going to read all 100 pages, but it's a real easy move through.
This is Diane. I guess what I'm suggesting is, to me, it makes sense to have the communication that we're sharing out with the community be coordinated, because I understand us reinforcing the information at the RSF level and passing this on there. But the overall communication, it seems to me, needs to be coordinated so that we are also then making sure that we're doing the appropriate outreach that we need to do, and that we're sending the right message, because I'm very concerned that doing them piecemeal through each RSF is creating confusion.
And I think we could totally talk, that's what I'd like this group to talk about. And I'm totally, that's why I think it comes from the recovery team as a whole. I just don't think it comes from the county necessarily as the only owner of this work. And part of it is, like, we can do some of it with information, but my hope is that, each of you can go back and talk about how in your areas, how do we put some of this together.
So, Diane, are you suggesting that possibly just messaging around this so that our community sees it, like this document, for instance?
Yes, I guess I'm suggesting that the coordination team through our public relations function is helping to coordinate a message that then the rest of us can be involved in sharing and reinforcing, directing people to the right information, as opposed to each of us trying to create our own somehow. I know we're a conglomeration of a number of organizations, but if we have something that is coordinated, then each of us can then share out that same coordination or that same communication with maybe a little bit of a targeted spin on it for our particular RSF, as an example. But I think that it's too much information for all of us to absorb and then trying to reconstruct, to re-communicate it. It just seems like that is best done in a very coordinated way.
George and Carrie, can you help with that?
Yeah, I would say we have a meeting this afternoon with the PIOs that touch pretty much all the organizations represented here, so we can talk about it and come up with something to help with that, is what I would say. And Carrie, if Carrie has a different suggestion.
Sarah, this is Beth. And I largely I tried to get an answer from KDHE on what is the distribution timeline for this round of money. And I couldn't tell that because, again, we're trying to manage round one well. And there are continuation of funding under a very big public health umbrella that timing is everything. So was that clear to you all?
So it's going to be different for almost every group in here. So this isn't going to be like round one where it just comes to the county and we do all the work. I mean, each agency that has a piece of this is going to run their own process.
Gotcha.
So
Gotcha.
I think it is I think if we have coordinated communication, and I think we can make that work, then once it moves out, then my hope is we can begin to specialize and divide and figure out really where we think our emphasis should be and who in our community as a team are we gonna sort of task with pulling people together to try to put together applications. That person then in that subgroup reads the RFP really well, makes the contacts with the state agency, finds out what the timelines are, that kind of work.
So that makes sense, Sarah. And just so you all know, and my RSF2 colleagues, most of the big money and the things we're asking for in RSF2, this community will not be eligible for under this money because we have a hospital and we have a lot of good capacity in this community relative to how this statewide distribution is going to be prioritized.
That's a good point.
And I hear you, Beth, on that. And I just also, I think sometimes, you know, we're the 5th largest county in Kansas. And I think sometimes we sort of don't give ourselves enough credit. And I can guarantee you that many of our peers in Johnson County, Wyandotte County, Sedgwick County are licking their lips at this money. And we should be competitive as a community. And if we sell ourselves short, we only have ourselves to blame.
No, that's right.
Thank you. I did see a note from Carrie saying that in the chat that she would help with this messaging that we're talking about. And then can Brooke or Sarah, can you share that with that document you just took down with Jillian, and she can pass it out to this whole group through Everbridge? That's easiest.
Yeah, I think Brooke can definitely send that to you as well as the PowerPoint.
Perfect. Thank you. Hey, George, did you have anything else that you want to talk about, PIO?
I mean, we can get started on that. Carrie has been doing a lot of the heavy lifting as far as recovery and the CARES Act public information. And I mean, a lot of our communication has been still focused on the response in the case, our case situation. We have received some good positive media coverage regionally in the past week about the effectiveness of our health orders in early July when we saw the spike and just how things have gone down since then. So I just wanted to mention that and thank everybody for their work. And then we are forging ahead on a couple of campaigns related to targeting the college age student population, just kind of that smart and safe messaging long term, and then parents of K through 12 students, so all the PIOs, and then some public health have been working with some outside groups on that. I think that's all I have.
Thank you, George. Anybody have anything for George or Carrie? Jeremy or Brooke? You have anything?
Hey, Robert. This is Brooke. I think Sarah covered most of what I would have briefed about today, the Spark Executive Committee update, and the timelines. So.
Okay, thank you. I see Tabor's on and Charlie was on. I'm not seeing him. Are you on here, Charlie? Oh, there he is.
I'm still here.
You want
a logistics update?
Please.
All right. The PPE cost estimates that were shared last week, I just wanted to point out that those were based on in-contract pricing from McKesson. And so anything that is out of contract is likely going to be higher. I'm not sure that we can, the extent that we can order through McKesson to satisfy the PPE needs for everybody in the community. So I just wanted to make that clear. Quick update on our logistics cache. We received face shields and gowns from KDEM, and Berry Global is still sending us some face shields through a donation that they made earlier this year. And then for gloves, the only thing we have on hand are small gloves. So we've been messaging that out. And then I just sent out the PPE survey report. I just wanted to point out that the N95 masks for the days on hand, that's declined by 45% from a peak in June, about a month ago. The drop is attributed to increase in the average daily use of N95 masks. The inventory for N95 masks is remaining pretty steady. But that was a pretty notable decrease. And that's all I have.
Thanks, Charlie. Anybody have any questions for logistics? Casey, did you have anything from Equity Impact?
Just a quick thank you to everybody for participating in the training. Our team's going to be meeting today with Human Impact Partners to debrief a little bit and come up with any follow-up that's necessary. Encourage everybody to follow through on their Trojan mouse. And so we might be checking in on the group on that in the coming weeks. And we'll work on, they did record the training, so if there were folks that weren't able to get on either of the two calls, we'll make sure to get out information on how to access the video.
Thank you, Casey. Any questions for Casey or any of the equity advisors? I just want to follow up. Most everybody knows this from our brief conversation last week that the Education Unified Command was stood up. We are meeting twice a week. We're meeting on Tuesdays and Mondays and Thursdays at noon. And we are pretty close to having the structure and the staff plugged into the boxes. We hope to have, we'll have a incident action plan brought to the table on Thursday, and then some other documentation, some guidance for the people on the team. So any questions about that? There was an article in the paper. Most everybody stays in tune with that stuff. So anything from anybody else?
Robert, one last thing on the equity. If those that haven't, just send us a quick email to say that you did the reading and watched the video. Since we recorded that in one of our meetings that we would all do that, we want to just be able to respond to that honestly. So we just have an Excel spreadsheet that just has an X next to the folks that participated and just send us a real quick email to say, yes, I did it. So that way, if we're asked, that we can, again, we can answer honestly to that. So just a quick email to either Robert or myself, we'd appreciate that.
Thank you, Jillian. Okay. Thanks everybody for your time. And this group will meet again next Tuesday. I think Jillian already updated the invite for 2 hours. We'll schedule it and go from there. All right. Have a good rest of your day. Thanks.